So we are going to discuss about pulmonary embolism. So what is pulmonary embolism? So pulmonary embolism is when we have the heart, the lungs, which sets on both sides, and the venous system, which drains blood into the right atrium and into the right ventricles, then into the pulmonary arteries, then into the lungs. So the presence of clots would then be drained into the right atrium, then into the right ventricle, then eventually when the right ventricle pumps blood, it would go into the pulmonary arteries where the clot could be lodged. So clots could also be caught into the small branches inside the lungs. So that is pulmonary embolism. In simple terms, it refers to the obstruction of the pulmonary artery or one of its branches by a thrombus. So next we are going to discuss the signs and symptoms of pulmonary embolism. So first, we have dyspnea, then phlegmatic chest pain, tachycardia, and hypotension. Next, we are going to discuss the pathophysiology of pulmonary embolism. So, the presence of pulmonary embolism would then lead into increased pulmonary vascular pressure that would cause a slight backflow of blood into the right ventricles, and so there would be an increased right ventricular pressure that would cause dilatation of the ventricles, and so there would be right-sided heart failure that would then lead into decreased cardiac output, stroke volume, and decreased blood pressure. So because of that, because of the decreased cardiac output, there would be signaling of the receptors that there is a decreased cardiac output that would simulate sympathetic response, and so there would be vasoconstriction and increased heart pump, but then it would not work due to the presence of lodge in the pulmonary artery. So it would just cause tachycardia and hypotension. So next, we are going to discuss the assessment and diagnostic findings of pulmonary embolism. So first, we got the chest x-ray, the ECG, the pulse oximetry, the arterial blood gas analysis, and ventilation perfusion scan. So it is necessary to recognize early diagnosis of pulmonary embolism because 1 hour after the onset of symptoms could cause death.